Hello everyone. Please let me introduce my PhD thesis title, The Relation Between the Maternal Factors and Birth Defects. My name is Zihan, and I'm a biostatistician currently working in the Department of Obstetrics and Gynecology at Semmelweis University. My mission is to provide a closer maternity counseling to prevent birth defects, and my vision is to increase other mother awareness and education to make fewer birth defects. Currently, I have two specific goals. The first one is investigating the association between the maternal risk factors and congenital birth defects, which started from the September last year. And second project is investigating the association between the maternal ambient air pollution exposures and birth defects, which start from the April this year. Both of them are systematic review and meta-analysis. Let's move to my first project, investigating the association between the maternal risk factors and the congenital birth defects. The congenital birth defects accounts for 1% of prevalence in the newborn babies, which is the leading cause of the newborn deaths. According to the data from the European Gestation and the Congenital Anomalies and Twins, for the mothers whose babies with severe congenital birth defects, only 40% of them will receive the prenatal diagnosis, and of them, only 20% of them receive it before 25 weeks of the gestation. It is worth noting that up to 30% of the congenital birth defects cases associated with the maternal environmental factors. So, we aim to identify the maternal risk factors that are associated with the congenital birth defects. Our clinical question is, what maternal environmental factors are associated with the risk of the congenital birth defects? We use a PICO framework for the observational studies. Our populations are the pregnant women. Exposures are the maternal risk factors. Comparison is the absence of the risk factors, and outcomes are congenital birth defects. We make hypothesis here. Some maternal factors will increase the risk of developing congenital birth defects. The systematic search was conducted on the November 16, 2023, from 3 main databases. As you can see in the search key, we have divided into 3 domains. The first domain is the pregnant women and its synonyms. The second domain is the risk factors. The last domain is congenital birth defects, and also is the most common 10 phenotypes. After 2 cycles of the selection, we've got 67 eligible studies. Additionally, after we finishing the reference choosing, we've got 19 additional eligible articles. So, in total, we have 86 eligible articles. This forest plot shows the association between the marginal active smoking and congenital birth defects. Marginal active smoking, that means the mothers active smoked during the early of the pregnancy, especially in the first trimester. As you can see in this forest plot, the data of the mother smoking was collected by the self-reporting data from mothers. We included 19 studies, and all of them are cohort studies and case control studies. The heterogeneity is 83%, which means high heterogeneity in this analysis. We think the source of the heterogeneity should be some studies they use the univariate analysis. And also, because we include different study types, and last but not least, some studies they have smoking bans, so we have very few patient population in their studies. The odds ratio is 1.28 with the clinical relevance and statistically significance. We suggest that the mothers smoked during the early pregnancy will let their baby developing the congenital birth defects increase by 28%. And the next forest plot is the aggregated forest plot. The data in this forest plot were derived from the pooled analysis for each marginal factors. As you can see, we found that the marginal obesity, diabetes, smoking, preeclampsia, and chronic hypertension have significant effect on the newborns developing the congenital health defects. Our study has some strengths and limitations. For the strengths, we included different marginal risk factors, factor categories, and congenital health defects phenotypes. And also, we include high numbers of mothers with their infants. And also, we use rigorous methodologies. However, some limitations should be noticed. Because of the data types, so we have various cutoff values, and also some self-reported outcomes were assessed in this study. And the last but not least, some covariance they are not considered. In summary, diabetes, obesity, smoking, chronic hypertension, and preeclampsia were found to be the critical marginal risk factors for the congenital health defects in their offspring during the first trimester of the pregnancy. For this study may contribute to the pre-pregnancy counseling and the pregnancy care. And also, for the future, we suggest that to do the longitudinal study to investigate the treated and untreated disease effect on their offspring. And also, doing the population-based study to investigate the impact of the demographic factors on the relationship between the marginal factors and the congenital health defects. Currently, we finished our manuscript writing, and we are ready for the internal review. My second project is investigating the association between the marginal ambient air pollution exposures and birth defects. The birth defects is the structural or functional disorders present at the birth, which is the leading cause to the disability and death in the newborns. Also, according to the data from the Eurocat, around 2.8% of babies were born with the birth defects, and only almost 2.5% of them died within a week. And for the ambient air pollution, it is the leading health risk factors. There are so many adverse vital outcomes associated with the marginal exposure to the ambient air pollutions, especially during the week 3 to week 8 of the pregnancy. However, such association, there's no consensus conclusion for that. So we aim to investigate the association between the ambient air pollutants and the birth defects. Our clinical question is, does the first trimester high exposures to the ambient air pollutants compared to the low level of the exposures increase the risk of the birth defects? We also use the PECO framework. The populations are the pregnant women. The exposures are high exposure to the ambient air pollutants, and the comparison is the low exposure. The outcomes are birth defects. We make hypothesis here. Some marginal exposures to the ambient air pollutants will increase the risk of the developing birth defects in the newborns. Our preliminary research was conducted on April 4th from 3 databases. And also, we changed to the, we have 3 domains for the search kit. The first domain is the pregnant women and its synonyms. And the second domain is risk factors and also the air pollutants. The last domain is the birth defects. Currently, we finished the draft of the Prospero. In summary, two studies ongoing. The first one is investigating association between the marginal risk factors and congenital health defects. And second one is investigating association between the marginal ambient air pollution exposures and birth defects. Thanks for your attention. Here is my quote. He was of an active nature and yet fond of learning, and he was not ashamed to ask and learn of his inference. Thank you very much.
Thank you for the presentation. first I would like to ask that when you were investigating the role of smoking, how did you define whether the mother is smoking? It was in the studies, were there any which were more objective, like measuring cotinine levels in the blood, or it was all questionnaires according to moms?
I think they are all the self-reporting questionnaires, because there was a criteria. They tried to categorize the smoking. For example, 1 to 2 cigarettes per day, on the 3 to 5, blah blah blah. We have separated into different levels. So I believe, to my knowledge, they mainly use the self-reporting questionnaires. So yeah.
So you were not, because you know, in the literature, sometimes we used to think that measuring cotinine levels is actually more accurate about smoking, because we know how the people used to actually be honest about being a smoker and how many cigarettes they smoke a day. So maybe considering adding these like subgroups could help with the actual measuring the actual effect of the smoking. That was just one of my comments. And the other, I was not sure whether I understood it well, because you said that one of the limitations of the study was that actually there were some self-reported outcome assessment. How is it? You mean that like it was the patient who had to like put in an application that? For
example, such as smoking and alcohol consumption.
No, but I mean like in the outcome, because I understand that if the smoking is but how an outcome can be self-assessed?
I mean the outcome means the outcome of the questionnaire.
Sorry, I meant
so some risk factors, because for the population-based study, we need to collect the data from the patient, from the population, right? So sometimes they try to report their situation to us, so there should be some risk of bias on it. So
yeah, I understand. Sorry, I thought that it's like, you mean like by the outcome of the heart disease that was self-reported. And also for my question is that I'm not aware that for the air pollution, is there any measurable, like the cotinine level, for example, in the blood for the air pollution as well? Is there any measurable?
Yes, there should be some standard for the air pollutants, and it has been published on the WHO and WHO website, I believe, yes. And there, because in the city we have so many air quality monitoring facilities, so we can use such data to see is this mother exposed to the high level or the low level. So yes, I believe it should be quantitative. Thank you.
Thank you.
So it seems that you have also considered alcohol as a risk factor.
Yes.
So you haven't found any association.
Yes. In my research, yes.
So you didn't show. That's why I was wondering. So thank you. You will be presenting those results as well in your publication.
It's a very interesting question, because in the previous meta-analysis, they report similar result as mine, but in the molecular side, in the molecular level, there should be some hazardous effect on the babies or fetus. So I think it also should be some bias during the measurement. Measure the data of the alcohol consumption, because some mothers they know it should be a bad behavior during the pregnancy, and they try to fake it. So
certainly it's just like smoking, like it's underreported.
Yes. So that should for the future we should improve these measurements. That should be the critical problem for the
Thank you, Zihan, for your presentation. I have one question regarding the congenital heart defect. So you showed the odds ratio associated with smoking. Could you give us some more specific examples? Like congenital heart defects is a quite broad term. What was the most common heart defect in these studies?
I mean, it should be the atrial septal defects and the ventricular septal defects. They are most popular I mean, the most common congenital heart defects in the world. So yes, we found so many significant results based on these two subtypes, two phenotypes. Yeah. Mm-hmm. So.
And do you have like another plot with the separate congenital heart defects?
Of course.
Okay, great.
As I mentioned, we have more than 50 figures in my manuscript, so I put them all in the supplementary files. Yeah. With the Furno plot and any other risk of bias assessment. So it should be a very mega manuscript. So we believe it should be a very good topic to discuss.
Yeah, thank you, Zihan.